Welcome. My name is Jasmine Kamboj, and I'm a medical oncologist and hematologist in the state of Minnesota and your host for the day. Empowering Oncologists is a podcast brought to you by OncoDaily, where we will focus on day-to-day concerns of an oncologist's being and workflow with a vision to find sustainable solutions. We hope to share our stories of wins, losses, resilience, and inspire and empower our community because we fly higher and longer when we fly together. Before we dive in, a disclaimer. The views shared on this podcast are an individual's and in no way are contributions from any institution, organization, or guidelines. For our session today, we will talk about challenges around cancer care in Brazil. Brazil experiences more than 500,000 new cancer cases per year. And just like several other regions of the world, it experiences unequal access to cancer care, fragmented care delivery, and limited access to research. So today we have Dr. Clarissa Mathias, who is a medical oncologist at Oncoclinicas and Hospital Santa Isabel in Brazil. She has served as the president of Brazilian Society of Clinical Oncology, has served on the board of ISLEC, and as past chair of the International Affairs Committee of American Society of Clinical Oncology, ASCO. Dr. Matias currently serves on the administrative board of Oncoclinicas and on the ASCO board. When not working, she loves to watch movies, study music, and study flowers. As we can see, she's in her garden right now. Dr. Matias, welcome and thank you for being here.
Thank you so much. Can I call you Jasmine?
Of course.
Okay?
Absolutely.
Thank you so much for the invitation. It's a pleasure for me to be here with you.
And you are joining us right after your comeback from the WCLC. That's how much committed you are to just, talking about the issues in Brazil and just, advancing development in cancer care and delivery. Thank you, Clarissa. Dr. Mathias, you trained in the U.S. and went back to your country to serve your people, right? In the U.S., we have around 1 in every 4 physicians who is an IMG or international medical graduate. But a lot of us do not go back to our country. So my question for you is, please share your story about your transitions and what was the driving force for you to go back, which is awesome, by the way.
Actually, I went to the United States to do my residency, really always focusing on going back to Brazil, coming back to Brazil, because I do love to live here. We have several problems. We have violence. We have, some governments that are not very steady, but I really love to be around my family, and we always miss that a lot. So I knew the challenges in terms of research, in terms of, starting the work the way I knew how to do in the U.S. would be huge, but I always wanted to go back. So I spent actually 8 years in the United States. And by the time you were ready to move back, my husband was always saying, should we go? Should we stay? And I always wanted to go back.
That's very special. To be with family is the most important thing. Thank you for sharing that. And where all in the U.S. did you train, Clarissa?
I started my training in internal medicine at the Medical College of Pennsylvania, which was the women's medical. And then I went to Penn. I went to Hub for my hematology and oncology. And then I ended up staying 1 year as staff while my husband was finishing his term.
So, Clarissa, our next question is a little bit of a pivot off from your training. You are now a leader in your country and your community, and also a global leader both with ASCO and ISLEC. Tell us, how do you wear so many hats and your journey to becoming a leader that you are right now?
I think it's truly related to teamwork. I've had many people who helped me along my journey and, working with great physicians, mentoring great people who helped me along the way and being mentored by great people too. So, of course, having opportunities, having trained in the U.S. helped a lot with ISLAC and with ASCO. So knowing people who were my mentors in the past, and who trusted me. So I think it was really sort of a combination of things. But I think trusting people and, working with people is really the key.
It's just like we say on this podcast, we fly higher and longer when we fly together. It's the teamwork that matters at the end of the day. Thank you.
Yeah, I love how there's a little story that sort of looks the same, has the same message about the African children that were offered like a basket with candy, and the one who's arrived before the first one would get the whole basket, and they started walking all together, and they share the things. So I think it's really about sharing.
Right. That's a beautiful story. Thank you. And Dr. Mathias, how is practicing in Brazil? How is that like different from the US? Is there more of equity piece, or there are more disparities in Brazil?
Well, there are lots of disparities, actually. In Brazil, 75% of our patients don't have private medical insurance. So they are served by the government through a program called SUS, S-U-S, which is unique system of health. That would be the translation, which is actually, we just turned 30 in terms of the age of the program. And it's wonderful, how you really have things that are very, very good in terms of the non-insured patients. But on the other hand, we do not have many things to offer those patients in terms, especially let's focus on non-cancer. So we don't have lots of the target agents. We don't have immune therapy because there is no money. Like if you allocate money for that, you would probably not vaccinate children and, or give the hypertension care that it would need, or, several other things. So it's really a conundrum that we are faced all the time. In the private sector, we have almost everything. We have the medications are now being approved very fast here. And we do have PET scans and MRIs, and NGS. We have everything. Sometimes it's hard to get access even if you have insurance. So that's a little tricky too. And one thing that I'm very proud of is that we started a research program as soon as I got back here in Brazil. And we've treated many, many patients by our group. And now we joined a major group that is headed by Dr. Fábio Franchi, who has a wonderful research expertise. So we do hope to really, place patients in research projects and do as I did at Huff, that at that time we opened a door. Now we open like a file. But, and we had one study for each patient. So that was wonderful.
Let me ask you this. Is there like an average time gap between a drug getting FDA approved in the US and being available to medical oncology versus Brazil? Is there, or is it just random and sporadic? It
depends a lot. Some drugs are available right away. For some drugs, it takes a long time. So it depends really on the studies, because we have a whole, it's not because it's approved by FDA or by EMEA that we now are, start the approval process. It does take time and take their own process. So, but now things are much better.
Dr. Mathias, tell us about the research and the infrastructure, and you've done a lot to extend and take the research infrastructure beyond the big cities and big institutions in Brazil to other cities. How does that work, and how has that impacted care in your country?
So I actually live in Salvador, which is it's the third largest city in Brazil, but most of the things really happen like in the south of Brazil, south and southeast. So when we started, I think it was really challenging because we started from like scratch, but it's been really great to see. And now we just got a wonderful person that actually, if you want to interview her, she's wonderful. Called Carolina Alves. She's a researcher that spent 6 years at Gustavo Rossi in Paris. And she came back to Brazil also, and she's with us, and she's the leader of research now. So I know she has a great story, and I know she's well.
I would love to chat with her and bring her on the podcast. Yeah, we'll connect offline to find more information about her. Thank you for that. Clarissa, what would be one piece of advice you would give to yourself of 10 years ago?
Let me see. It was before the pandemic. So I think really during the pandemic, I started looking more, taking more care of myself. I think we had the time to stop and to think. Most of us faced COVID and faced what is to not be here, a little bit if bad things happen. So I think it's really about that, trying to live the present and try to be the best we can.
Absolutely. And also like to, as you said, slow down sometimes and reflect and step back and reflect on what you really want to do with life. Beautiful. Thank you. A bit of rapid fire about you. Your favorite book?
The Little Prince.
Okay. Is there something in particular you like about it?
I think it's really that thing of, taking care of someone and making that person be important, like he did with Tame, right?
Right.
So, like it did with his flower and how he... It's really wonderful.
Beautiful. Yeah. Your favorite leader, Clarissa? I know that's an unfair question.
That's a very unfair question. But I think Gandhi is my favorite leader. And Jesus. But Jesus is beyond that. So
yeah. That's awesome. Thank you. Is there any favorite restaurant in Brazil or where you live that you'd like to share with our audience?
Here in Salvador, let's see. Oh, there's so many great restaurants, but there's one called Mistura, which is really good here at Salvador.
One fun fact question about you, Clarissa. By the way, I was surprised when you told me that you are a grandma because you do not look like a grandma at all.
So I am a grandma.
So any proud moments or fun moments you want to share with us about being a grandmom?
So it's wonderful to be a grandma. People used to tell me it's great to be a grandma, and I was like, you know what? I was such an involved mother that I think it's almost impossible to be more involved. But it's, she's been like the shine of my existence. She's really great. It's great. Maybe, now that I'm older and, I have less responsibilities towards her education, I only have to tame and take care.
Right.
It's wonderful to listen to her and to see her growing. She's 2 now.
That's lovely. That's lovely. Thank you. Yeah, you get to be the fun grandmom and parents can be the bad parents, right? That's how I feel.
I respect a lot.
Right?
Yeah.
So, yeah, I think between me and my mom, I think she gets to be the fun grandmom and I'm the villain of the house.
No, but she respects a lot. So
yeah, beautiful. Well, thank you, Dr. Matias. I'll have 3 closing statements or the 3 key takeaways for the oncology community from Dr. Clarissa Mathias's conversation on empowering oncologists. So Dr. Matias trained in the U.S., but actually took her experience, her wisdom, and her network and the benefit of all of that back to her own country and community. So there was a lot of there was a lot of benefit, that we can render to our countries and our community by training in other countries as well. So that's number one. She has worked with organizations and governments to bring about the much needed change in healthcare and infrastructure in cancer care in Brazil. And I think that kind of rule applies to pretty much everywhere all across the globe. Policy change is key to bringing out any infrastructure change in healthcare. And then, research and trial access obviously can be impacted by something that she did. She took the research infrastructure beyond the big cities into the smaller cities as well, into different institutions as well. And then last but not the least, prevention of cancer and quality of life of patients are critical issues, and we need to strive for focused efforts in those spaces as well. So thank you so much to our viewers and listeners. This is Jasmine Kamboj and Dr. Clarissa Mathias signing off on behalf of OncoDaily from our conversation on Empowering Oncologists. And now we have the Empowering Oncologist playlist on YouTube. Don't miss an episode and stay tuned. Thank you, Dr. Mathias. Thank you to our listeners.
Thank you so much.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.